probably no other community in the state has lost a huge university and all the students that go with that, and then a week later lose their other biggest industry, which is tourism. I really do believe that our county and our area has taken probably the biggest hit of any place in the state of North Carolina.
Today is Friday, April 10th, and we are pleased to be joined by Ray Russell, who represents Watauga and Ashe counties in District 93, the North Carolina House of Representatives. Ray, we very much appreciate you being with us today. If you could first start by talking about just what you're hearing from constituents in your two counties. What are the top concerns on everybody's mind as we sit a few weeks into this pandemic response now?
So obviously the first thing is everyone's fearful about health. I mean, this is a health crisis first, and this is a very secret and silent virus, and you can't see it. It creates a lot of fear among people, and so I think that's first and foremost, and people protecting their families. What are the best practices? There's a lot of bad stuff out on the internet. What a surprise about that. And finding clear and consistent good voices on making good healthcare decisions for themselves and their families. I think that's first. Secondarily, but almost as strong, is the economic crisis we're facing with unemployment. How they're going to pay their bills, how they're going to pay their mortgage, the people that are receiving those checks normally, how they're going to pay their bills, and the huge impact we've had on small businesses. I tell people in Raleigh, at the governor's office and the legislature every day, that Boone, I really do believe, is kind of the economic epicenter of this crisis. Probably no other community in the state has lost a huge university and all the students that go with that, and then a week later lose their other biggest industry, which is tourism. I really do believe that our county and our area has taken probably the biggest hit of any place in the state of North Carolina. So those two things. But interestingly enough, as we move through this, I'm hearing more and more people talk about our looking after our more vulnerable families and mental health issues and things like that. All of those are big topics as I talk with people.
Governor Cooper on Thursday, April 9th, signed another executive order, and this one will bring stricter social distancing guidelines to many of the essential retail locations that are still open. Was this aimed at being as much of a balance for safety of employees as it is customers in these locations?
I think I've gotten a number of emails about what about these people at checkout counters and they don't have masks and they're being exposed to everyone and just people concerned about them. That email's come to me from several places. So I think there is concern both for the workers' health and also to provide confidence for people going into stores and feeling good about it. So if you want me to, let me just run down a few of the things that are in that executive order. There is a limit now of the number of customers in any store to 20% of the fire marshal's limit of capacity on the store. In common areas where like checkout lines and other places where people might congregate, they're supposed to be marking out 6 foot, where 6 feet actually exists, so people know where they're supposed to be and not accidentally get into other people's spaces. Enforcing rules on cleaning, even though all the stores that I've been in have looked remarkably clean and and I had confidence walking into stores, but those have gone from recommendations to rules. One thing that will be different here in the next week is laying out one-way aisles and keeping the flow fairly uniform so that people aren't passing each other and such as that. There are also recommendations about face coverings for employees, recommendation for having shopping hours for seniors, which my mother wants. She doesn't live in Boone, but I see she talks about that on social media every once in a while. And there are a number of other things just to, I don't think there will be, have a huge detrimental impact. I think it's just laying things out so that it'll be a little more orderly and as we go forward.
One of the other elements to that executive order included some additional support for the unemployment process and giving employers the opportunity to basically batch unemployment claims of their employees to try to move those through faster. We've heard a lot about DES and their response to unemployment claims and the volume that they're dealing with, and also heard about new technologies and other things that have been implemented along with hiring more people. Have you noticed any speed difference here in the last few days about how unemployment checks are being processed and the entire system is working now that, again, we continue to see these unprecedented volumes?
Well, about DES, let's talk about that a little bit. I know I'm not seeing any, I am seeing DES work like crazy to solve problems, but they have a tremendous traffic jam right now to deal with. Let me share a graphic with you just to give you an idea. Let me try to do that here as quickly and efficiently as I can.
I feel the weatherman coming out in you here.
Yes, here we go. All right, so here's a graphic I got yesterday from DES. So look at the week starting around March 16th right there. Now, keep in mind that the system that they had in place on March 16th, which worked fine, was built to manage a maximum of 3,000 claims per week. So both from the terms of technology and from staffing, 3,000 per week. And then look all of a sudden on around the 19th, there were almost 35,000 claims show up in their system. So they're handling about 150,000 claims per week. That's in a system that was intended to max out at 3,000. So they have a tremendous challenge on their hands. So, you know, that graphic right there should tell us that they've got just a monumental effort that they have in order to make this go. So, you know, it's going to take a while for that traffic jam to end. And the main thing I want to say about DES, these are great, competent people, and they are ramping up technology and servers at an unprecedented rate. They've hired hundreds of new employees, but those employees have to be trained and have to understand very complex systems. And then they've put 2 new call centers are being ramped up right now. I think on Monday, Lockhart Taylor's the head of this. I think he said they took 270,000 calls just Monday.
Wow.
You know, they do not have the staff to manage 270,000 calls. So as much as people need this money and it's just going to be a real challenge for a while to just let the traffic jam kind of work its way out over time. They've received almost 500,000 claims in just a little over 3 weeks. The other complication for them is how long it's taken them to get the rules from Washington. You know, not everybody understands exactly how this all works. So Washington provides some of the basic mechanisms for funding for unemployment and decides the rules, but the state then administers it. So there are 3 new programs that were rolled out in the CARES Act. They got the rules for those programs just last Saturday night and Sunday. So they've only had them now for 4 or 5 days. One of those programs has 43 pages of rules. It's going to take a while for them to be able to, now they got to program their systems. I'm a computer scientist. I understand the challenges they'll face there. So I do have some dates that they put out, and I'm not going to try to confuse everybody. You know, we got basic unemployment that's in place that maxes out at about $350 a week for employees. That's the max check. That's what was already in place in North Carolina. The FPUC program, that's the one that adds an extra $600 a week to people's checks. They got those rules Saturday. They think they will be able to start writing those checks April 17th. But everybody should understand that once they start writing them, it will be retroactive. So that money will be coming, but they only got those rules on Saturday. So it takes a while for them to be rolling out checks on the 17th is remarkable. You know, 1 week, basically a 10-day turnaround from the time they get the rules. And the other one that a lot of people are asking about, the PUA program, that's what will provide support for independent contractors, people get 1099s instead of W-2s, those folks. That's the program that had 43 pages of rules that all now have to be programmed into the DES system. That one's going to take longer. The hope is that those checks will start flowing around April 25th, but that's even a whole new application process that is going to be more complex because these are people that are not in the system already, and they're not getting W-2s and all. So there's a whole new documentation system that's going to have to be in place and verifiable. Just one other thing that you mentioned in the executive order from the governor yesterday, the one big advantage will be allowing employers to file for their employees in batch. It will streamline the system a little bit. Right now, what has to happen is that an employee files, and then it has to go back to the employer for verification. And then the employer has 10 days for that. And of course, employers are having a hard time getting access to the system as well. So once this new process is in place, it will streamline in that the verification will come with the application in the first place, and people will be able to file in bulk. So I just want to assure everyone, I have the DES folks have been briefing legislators multiple times a week. They are working night and day. They will not get a holiday weekend this weekend. They will be working through the weekend. They care about the people of the state of North Carolina and are doing everything they can to get money in people's hands as quickly as they can. And while all of that was going on, they sent out, I think, 110,000 payments, and I've forgotten how many millions of dollars that came out while they're trying to process these claims as well. So it's a Herculean challenge for them. They're up to the task. We just have to let the traffic jam kind of settle. Imagine being at, the massive, 100,000 person event, and now all the people have got to get out of the parking lot. It's going to take a little while for that to happen.
Ray, part of the broader stay-at-home order, we're about halfway through that, maybe not quite, but we're nearing the midway point of the governor's stay-at-home order that started toward the beginning of the month. Has there been much discussion yet about extending that order, or even more so, what it will look like on the backside of that order in terms of being able to release and return to somewhat normal pattern? Has that conversation started at the state level yet?
I wouldn't say exactly that conversation has started, at least so that it's getting to me. I'm sure internally there's a lot of conversation going on about that. We did receive one report from a scientist last week, epidemiologist and data scientist, and they looked at two questions. One was, what if everything turns loose on April the 29th and North Carolina goes back to business as usual? What that would look like from this, not from an economic point of view, but from a healthcare point of view, and what would happen with coronavirus, versus what would happen if the similar restrictions or social distancing rules, and or at least social distancing rules that were just as effective, if they continued through the end of May. The differences were startling. Basically, if similarly effective social distancing rules remain through May, they suggested that there was a very, very low risk of overrunning our hospitals with new infections and new cases and such as that. On the other hand, if they turn it loose, they actually didn't just let everything try to go back to normal suddenly, schools and such. They had a better than 50-50 chance of overrunning our hospitals with overrunning the capacity that our hospitals have for taking care of patients, and even somewhere around a 60% or better chance, particularly of ICU beds being overrun with patients. So that's not an economic study, that's purely a disease study. So I think there's among the people that study diseases and understand this virus the best, there's tremendous concern about everybody just all of a sudden one day saying, oh, it's all over and we go back to business as usual. That would almost certainly see a secondary surge of infections and illness, that would be the worst case scenario. I can tell you that for sure. If we get a second surge and have to deal with that, but exactly what that looks like, I do not know. I think our state has done a tremendous job, and the people of our state, as much as anything, have observed the rules. It is saving lives every day. We're seeing some of the modeling looking more optimistic, and that's only because we're doing what we're asked to do. And I saw last night the head of the CDC say this: coronavirus has one big weakness. It can't swim more than 7 feet. And so we have to exploit that weakness of keeping the social distancing in place. It is an incredibly effective virus in spreading, but it does have that one weakness, and we've got to exploit that. So I don't really know what this is going to look like coming out of it. I just know that the worst case scenario is for us to do it too quickly and produce an effect that's worse than what we've seen so far.
Ray, soon it will be time for legislators to go back down to Raleigh, or whatever that looks like from a virtual perspective here as we get a little bit later in April. As it relates to COVID-19 response, what do you feel like some of the top priorities of both chambers within the legislature will take up when you get back?
So the House is conducting meetings on 4 topics right now. The 4 broad topics are healthcare, economic support, state operations and public safety, and education. So in all likelihood, there's no announcement and no firm plan on this. In all likelihood, we will go back into session for just a few days at the end of April or 1st of May, somewhere in there. We probably will not be back in chambers. The discussion that I'm hearing is that we wind up at the Raleigh Convention Center, where there's much more room for everybody to have social distancing and try to keep everybody healthy. Of course, there has been a case reported in the legislative building in a cafeteria worker. Of course, we know the state treasurer contracted coronavirus, was in the hospital for several days. That spread to other workers within the Treasury Department in the state. So, you know, and let's be honest, a lot of the people in the legislature are old, older than me. I'm probably about in the middle of all that age-wise. So, you know, we certainly did not want to show up there and get our own members sick and staff members and such. So I think we will come in, we will address just the set of issues that are emergency issues for the coronavirus pandemic. Right now, our governor has done a tremendous job of managing this crisis by executive order, but there are a number of things that he does not have the legal authority to do by executive order that are going to require legislative action. That's what these committee meetings are about or right now. Yesterday, I sat on an education meeting, and every item in the meeting was about, okay, here's a problem we know we have because the schools are closed. You know, what's the recommended action for the legislature that is required in order to address that problem? I think on those issues we'll see broad bipartisan support. I think we'll see a series of bills in the course of 3 days or thereabouts to address these, and then I think we'll go home again for a while. The other thing that's happened in all this is, since now our taxes are not due until July 15th, having a discussion about the budget is not even reasonable until the tax due date, because that's when most of the state tax revenues will be seen. So we won't know how to address budget issues until after July 15th. So I think you'll see us go in session for a very, very short period of time, end of April, deal with emergency issues. Then we'll go home and probably show up the end of July into August and then tackle budget issues. One important thing I think everybody in North Carolina needs to know: we're so used to the federal government being able to, you know, $2 trillion relief bill. Sure, why not? They just print more money. You know, they can do that. The state can't do that. We have to pay our bills as we go. We have a constitutional mandate of no deficit spending. So, and if just like our own personal pocketbooks are suffering and our businesses are suffering, the state coffers are taking a huge hit as well. And we're probably going to see somewhere in the neighborhood of a $1.5 to $2.5 billion shortfall in revenue in the biennium relative to what we thought was going to happen. And there's going to be some grim work to be done when we get back to Raleigh to figure out how best to use the resources we have. And we've had, like everybody else, also new expenditures that were not anticipated as a result of this coronavirus. So it's going to be difficult work when we get back to Raleigh and really deal with these budget issues, but that probably won't come until late July and August, I think, is when you'll see that happen.
Well, Ray, I will say the same to you that I said to Senator Ballard and Congresswoman Fox, as we have talked to those two representatives during this time as well. I applaud your accessibility and your ability to talk about these issues and inform the public in a way that's understandable, that's not filled with a lot of political jargon and legalese, that just says, hey, here is what we're facing. This is what we're trying to do about it. And I know that resonates well with a lot of people. I've got one final question for you, and then we'll let you go. And kind of ending on a positive note, we've seen so many heroic stories develop of people helping address community needs. You've touched on some of these issues that resonate well within Watauga and Ashe County, certainly, of people needing to help people. What are some of the silver linings and signs of human spirit that you have seen that have kept you motivated to make sure that you're doing all you can for your constituents and for the state as well?
Thanks for that question. Let me say a couple of things before I get into that question. One of the things that for sure happens in a crisis like this, and I think this is one of the greatest crises of my lifetime, and I'm 63 years old, and we've never seen anything that rivals this. I've always believed that leadership emerges. It's not that leadership is created in these times, but leadership is revealed, I think. And you know, I want everybody to pay attention to who we're relying on right now to get us through this. We're relying on our public health officials and App Healthcare, and the folks that work there have done a tremendous job of leadership in getting us through this. We're relying on our hospitals, and the folks there have done a tremendous job. Law enforcement, EMT, emergency management, our county managers, our town managers, our public schools, and yes, indeed, our chambers. David, you have done a tremendous job in helping get us through all that. And, you know, it's too early to talk about what lessons we're going to learn from this. But one thing is clear, we need to remember who got us through the crisis when the crisis is over. You know, those are the people that build resiliency into our communities. And we need to make sure we take care of those institutions when all of this is done. Another thing I'd like to do, also speaking on accessibility, my Raleigh office pushes out a newsletter every weekday and as needed on weekends. So it's going out. We also put it on our Facebook page as well. I think 1,700 of these emails go out every single day. If you want to sign up for that, it's ray.russell@ncleg.net. I'll say it again, ray.russell, there's two L's in Russell, RUSSELL, @ncleg.net, and be a part of that newsletter that we put out every single day. We do put it on our Facebook page as well. So, you know, we've worked hard to make sure that news from Raleigh and news from our district gets out. But, you know, there people all over our community have stepped up. I'm seeing every day people donating to, creating funds to help individuals and small businesses get through this. We still have a ways to go, and the crisis has not been fully revealed to us, I don't think. As Dr. Fauci said a week or so ago, we will not decide when this ends. The virus will decide when this ends. And it's not going to be like some of the other crises, you know, or pandemics that we've seen before. I mean, we're accustomed to this coming, we have a big wave, and then we put it in a can and throw it away. This one's going to be with us for a long, long time in one form or another. We're not going to stay in the crisis mode that we're in, but it's going to be with us in one form or another for a while. And people are stepping to the plate with food. I was in Ashe County last Friday at this time, handing out food at the Ashe Sharing Center. The people at Ransom and Wine to Water and Vincent Properties, they immediately jumped in. The chamber has done a great job in pulling together resources for people. Watching our schools, I've lost count with Dr. Elliott, how many meals have gone out from the school system. And our nonprofits are stepping to the plate. We have such a great system of folks in the background who are now in the foreground who are making this work. So that's going to continue to be the case. The emphasis will change over time. That, you know, there's going to be more need for emergency food, but also mental health care and all kinds of things like that, and looking after our most vulnerable families in our community. And we have the people in place that are going to make that happen. And we should be proud of the community we live in to be in a place where that does indeed happen. And we're certainly rising to the occasion.
Well, Ray, we appreciate your time and your leadership through this, and again, appreciate all of you that represent this area being so accessible during these times to individuals and businesses. That is certainly something that is appreciated and is helping people more than you realize. So we look forward to talking to you again soon. Thanks for your time.
Thank you so much, David, and you and everyone else.